Hello everybody, in this video we will speak about the therapeutic dialogue. It is the core of the therapeutic process in the Bach flower therapy. In classical medicine, the process of the therapy is usually linear. So there are some diagnostic procedures, and then there is a diagnosis, and finally the result is the suitable therapy. However, in the Bach flower therapy, the process is usually cyclic. Why there is this difference? The reason is that Bach flower therapy differs significantly from classical medicine, and we should respect this difference. Here are the principles of the Bach flower therapy, and especially that the patient has his will and is able to make his decisions is very important. We must invite the patient to make the decisions together, to participate in these decisions, and that the remedy is effective only when its action is in accord with the goal and effort of the patient. There are no other resources for the treatment than the patient has, so he must use these resources to deal with the problem. If you haven't seen the video about the principles of Bach flower therapy yet, please click on the link below the video. The therapist and the patient see the problem differently. While the therapist, thanks to his experience and knowledge, and thanks to the fact that he keeps a distance from the problem, he usually sees the problem in more width and depth. He is aware of the aspects that aren't really obvious. The patient concentrates on the most striking, most annoying part of the problem. And that is why the Bach flower therapy is about cooperation. We can compare it with mountaineering. You cannot go ahead. You always must keep the pace with your partner, and you need to know constantly where he is and in which direction he plans to move. So the therapeutic dialogue means that you constantly interchange the information with your partner, with your patient, with your client, and you need to know where he is and where he wants to go. So let's start with where he is, and the best way how to know all the time where your patient is to use the communication techniques, especially reflections. For example, in this example, the patient describes you: when we have to hurry up in the morning to the kindergarten and my son decides he wants to play now, I sometimes burst with anger, and then he gets his tantrum. So you may think about impatience. Maybe the patient needs impatience. However, so you use the reflection. You do not like wasting of time, so you explore the theme of impatience. However, the patient corrects you. Well, maybe it's more that I have a fear of coming late to my work. My boss is quite strict and he does not tolerate late arrivals. So the result is that the patient probably needs Mimulus as a main remedy. The whole consultation is full of these adjustments and of this feedback. If you haven't seen yet the videos about the communication techniques, please look at the link below the video. And the second question is, where are you going? And the direction means which remedy do you like to use. And so when you have already collected enough information, you can offer some remedies to the patient. And again, this is a process, or there is a process of discussion. You cannot give him just take Mimulus, it's okay, but you should offer him this Mimulus. And you can offer it in your own words. For example, you have told me that you have a fear that the boss gets angry to you. This theme of fear can correspond to the remedy Mimulus. What do you think about that? Another option is to read to the patient the exact description of Edward Bach himself. And this option has an extra bonus because the patient often feels surprised by the fact that Bach himself knew and described so well his feelings more than 8 years ago. So you can download the book or booklet of Edward Bach 12 Years directly from the page of Bach Center. And I use it this way. I have some idea. I will read you the description of a remedy. Mimulus, fear of worldly things, illness, pain, accidents, poverty, darkness. You can also add, for example, also of conflicts or criticism, the fears of everyday life. These people quietly and secretly bear their dread, and they do not freely speak of it to others. What do you think about that? And sometimes, especially when you would like to recommend to the patient some remedy that has some negative connotations, usually, for example, remedies from the overcare group or, for example, Heather, you either have one option to prepare a positive description of the remedy. That might not be so easy often. And you can also use the descriptions of Bach because they are very empathetic. For example, here is a description of chicory. You know that chicory is typical for manipulation of smother love, of emotional extortion, but you cannot tell it to the patient because it would certainly disrupt the therapeutic relationship. So you can read to the patient the following description. Those who are very mindful of the needs of others, they tend to be overfull of care for children, relatives, friends, always finding something that should be put right. They are continuously correcting what they consider wrong and enjoy doing so. They desire that those for whom they care should be near them. It's surprising how many chicory patients become moved or by this description. They even can start to cry because they finally hear somebody to speak about their innermost emotions, innermost feelings. And they take it often as an appreciation, this description. And medicine has always been an art of science, and art and science, and a combination of logic and intuition. And it's very important to use the both parts. Of course, you can deduce something directly from the conversation, so it's the logic. But sometimes you have some feeling as if the patient had also another phase, another aspect that you cannot grasp fully, but you feel that it is present. For example, you may feel that the patient is overcritical, but during the consultation he tries to be tolerant, but this tolerance is not true. So in this situation, I use the following technique. For example, I think about beach in this situation. So I tell, one idea has come to my mind. It's probably nonsense, but to get rid of it, I need to read it to you. And I read the description of beach for those who feel the need to see more good and beauty in all that surrounds them, and so on. And finally I add, what do you think about that? And some patients directly discard this remedy. On the other hand, there are also people that start to speak, okay, maybe there is something, and you can continue with the discussion. And finally, you can prolong the process of selecting the remedy to the time between the consultation. And you can suggest the patient to look at the essences himself and to study them, and maybe to try to find other remedies that could be suitable for him. And next time you will discuss about these suggestions. And because the patient usually sees only the surface of the problem or the upper part of the problem, and isn't aware of the underlying layers. So the process is sometimes called peeling of onion. It means that you concentrate on the most superficial part, you remove it, and then another part appears and you continue by peeling another layer, and so on. That is why sometimes the picture, the problem, or the feelings of the patient completely change. So be not surprised and do not stick to the first combination, because an adjustment will be necessary. And the therapeutic dialogue is a very important predicting factor for the success of the therapy. Under normal condition, there is always some part of agreement and disagreement. The patient agrees with something and disagrees. And it is a good sign. It means that you will adjust the therapy according to the reaction of the patient, according to his needs. However, there may be also that he agrees with everything. So it means maybe that the patient perceives you as a big authority. Or the patient is too submissive, so maybe he will need something like Centauri. Or maybe the patient does not trust his ability to decide, so maybe Serato might be useful for him. And as a solution, I offer to the patient more than 7 essences, so he has to choose which of them abandon. It is also possible that the patient refuses every suggestions, and that's a problem. There is probably some problem in the therapeutic relationship. For example, the patient was pushed into the therapy by his wife, and he doesn't like to be treated. Another possibility is that the patient feels threatened by your very personal questions. He just came because of eczema and you ask him about the relationship, about the family, and so on. So maybe he will need Holy, but not at this moment. And the patient has a fear of making a mistake. So maybe he will need in the future mimulus. And the solution, the most safe way, or the safest way for this moment, is to offer just crisis essence and wait. Maybe the patient won't come again. Maybe he comes and maybe he will be more open because he verifies that you are not, or the therapy isn't dangerous. And it is especially the situation of mimulus. And finally, maybe the patient is indifferent to all the options, and it means that he is not interested in the therapy. There is really some problem in the therapeutic relationship, or the patient doesn't trust the method, and it's usually a loss of time for both. So, thank you for watching this video. I hope you have enjoyed it. And in the next video, we will demonstrate the communication techniques and the therapeutic dialogue on a real case.